Hello, welcome to our post-treatment instructional video. This video is designed to help maximize the healing process while reducing any issues that may occur post-treatment. Without further ado, let's get started. We want you to take it easy for the first 3 days following today's procedure. Anything that could cause the blood flow in your head to increase can also increase discomfort and inflammation, including doing a lot of bending over. Also, if you were given ibuprofen, we want you to take that for the first 3 days. With the ibuprofen, after the 3 days, you're just going to take it as needed. Even if you feel good, we still want you to take it. It helps reduce the inflammation, will help with any discomfort, and also help with bone healing. If you are taking Tylenol, you can take Tylenol as needed for discomfort. If you were given an antibiotic, make sure you complete that series. Avoid any alcoholic beverages while you're on the antibiotic so it does not counteract the effects. If you are on an antibiotic, you still want to look out for signs of infection. Discomfort and inflammation will peak at 48 to 72 hours and slowly start to get better. If you notice it starts to get better and then all of a sudden becomes swollen again, if the discomfort increases again, if the area feels warm, or if you start to run a fever. If you experience any of those symptoms, you give us a call. Symptoms usually start to show itself between 4 to 6 days post-surgery. Inflammation is also normal. We want you to ice the area on the outside for the first 24 waking hours. You're going to do 10 to 15 minutes on, 10 to 15 minutes off. Our ice pack that we're going to be providing you will not freeze within 15 minutes, so we do recommend you have another ice pack. You can use a frozen bag of peas or corn or even crushed ice to rotate with the ice pack that we will provide you. We want you to ice the inside as well by sipping on anything that is icy cold. Ice water, iced tea, iced coffee. You can even do ice cream, milkshake, smoothie. Just make sure there are no seeds or nuts. Bleeding is also normal. We want you to first try sipping on ice water because the ice water helps blood vessels contract, which helps stop bleeding. You should have been provided a pack of gauze, which you can use to apply pressure to the surgical site for about 5 to 10 minutes. Check it and keep repeating the series until you don't see any more bleeding. You can also try placing gauze and sipping on ice water so the gauze can absorb the icy coldness and isolate it to the area. If you still see bleeding after an hour, use the tea bag that has been provided in place of the gauze. Just moisten the tea bag and apply pressure to the surgical site. The acid in the tea will help stop bleeding. If you get an excess amount of bleeding, it's usually due to trauma. Please give us a call. We provided you a bottle of Paradex mouthwash. This is what you're going to be using to keep the area or areas clean for the first 2 weeks until we see you again for your first follow-up visit. You're going to isolate the mouthwash to the surgical area or areas, not doing any vigorous swishing, mostly letting it saturate the area. You can also take a Q-tip, dip it in the mouth rinse, and very gently roll it along the area. You do not want to rub it because we do not want those tissues to move, so just roll it over the site. You do not want to eat or drink anything for an hour after using the mouthwash. So after breakfast, you've already eaten, and before bed, you've already eaten. In between the 2 rinses with the mouthwash, which you will do after breakfast and before bedtime, you're going to rinse with either warm salt water, not too salty, or peroxide. So basically, after you eat anything, you're going to do a very gentle rinse to help remove any extra debris. It is very important to stick with a softer diet. Avoid anything that can jab you in the gums or get lodged in there. So avoid all berries because all berries do have seeds, poppy seeds, sesame seeds, and also those things that are crunchy or fibrous like chips, nuts, toast, popcorn. Anything that can jab you in the gums or get lodged in there can cause infection. We also recommend that you stick to a high protein diet. High protein helps promote healing. So if you like things like protein drinks, Greek yogurt, cottage cheese, eggs, soft fish, you can even do meatballs, meatloaf, mashed potatoes. You can do pasta, soft steamed vegetables, anything that's at a softer consistency that does not involve a lot of chewing. And do all your chewing on the opposite side of where the surgery was performed. We want you to avoid very spicy, salty, acidic, and hot temperatures. You will be more sensitive to these things. If we use sutures on you that will dissolve, they can also make the sutures dissolve quicker than we intend them to. The sutures will typically dissolve within 5 to 7 days. So if you wait about a good week, that's usually when the sutures have already dissolved and the sensitivity has gone away also. If you had the sinus lift procedure, we do want you to get an antihistamine, which would be like a Benadryl, and also an Afrin nose spray that you will be taking for the first 3 days post-surgery. If you had bone grafting done, it is normal for your body to push out loose bone seed particles. They look like little grains of sand. So if you see some loose bone seed particles, do not be alarmed. It is completely normal. If you get an excess amount, give us a call. If you have any questions, concerns, any problems at all, please do not hesitate to call us. You have also been provided with the doctor's phone number. If it's after business hours, you may give them a call for any questions or concerns.